one of the things that I advise you today, or any of these job fairs that you go to, is really be open. Look at what the possibilities are. Just because you've been a critical care nurse for the past 10 years or whatever, doesn't mean that that's the only thing that you can do, or that you'd love to do, or that you'd be interested in doing, or that you'd be good at. One of the most interesting things I think personally about being in healthcare is the options that you have. Just because you start, in the billing office doesn't mean that you end your career in the billing office, or just because you're a nurse on med-surg doesn't mean that that's where you're going to end up. There are so many options. And nowadays, with the growth that we're seeing in ambulatory, it's just remarkable, what those options are.
Hi, my name is Michael Scott with the Colorado Hospital Association. We're here at the Sports Authority Field, and this is where we're holding our 2014 career event. Today we have over 50 hospitals that will be seeking job seekers and another 13 other healthcare employers. We're expecting from 300 to 500 job seekers to attend today. We look forward to connecting them with the opportunity to work in Colorado.
One of the best things about working in healthcare is, regardless of whatever level you start with, if you start as a CNA and you do that for years and you go to school at night, you can become an RN. If you start out as a clerical staff, you can go to school, get your degree, and become a medical records coder, a biller, a manager. There are just endless possibilities as to what you can do. You can become a technician in a lab. Radiology, CAT scan, MRI, echocardiography. There are just a multitude of things.
My name is Ian, and I am a recent graduate of the Colorado School of Public Health. I'm an epidemiologist, and I am primarily interested in finding out what my role is in the hospital setting, if at all. I know that one of the key features of healthcare is trying to move people from an area of disease management more to an area of preventative medicine. So I'm trying to find my space specifically in the hospital setting so I can fulfill that goal.
But most of them require an education. They require you going back to school, online classes, whatever it might be, whether it's a certification, it's an associate's degree, it's a bachelor's, it's a master's, whatever it is. But I think one of the really nice things about working in healthcare is that the benefits that you're afforded, most places will give you reimbursement. They will give you continuing education type credits. Avail yourself of those. That is a benefit that you are entitled to. Use those credits, use those dollars to advance yourself professionally.
My name is Kayla Lewis. I'm a senior recruiter with University of Colorado Health System, and this is my coworker, Michael Booth.
Michael Booth, senior recruiter, University of Colorado Hospital.
We love coming to the job fair.
Love it.
We come twice a year in the spring and the fall. Last spring when we came, we actually were able to hire over 5 candidates just from being here, meeting people face to face, having the opportunity to collect their resume, learn a little bit more about them, and see what they would bring to our organization.
I think as a candidate, it really benefits you because you get that face-to-face interaction. Very different than over the phone or internet or email, so it gives you the opportunity to get right in front of us.
And so this is a great opportunity to meet a ton of people from different systems and hospitals in the state, and it also puts a face to a name of, healthcare human resource recruiters that you may be talking to online or via email. It's a great way to get to know them in person too.
Hi there, my name is Lauren Trunick, and I'm with National Jewish Health located in Denver, Colorado. We have been around since 1899, very specialized respiratory tuberculosis cancer research institute. So we have been coming to this actual organizational career fair because we receive some of the best candidates from this career fair.
Don't jump at a position just because it's available. Make sure that it's going to fit with your personal beliefs, your culture, and you like the culture of that organization. Because you spend an awful lot of time at work, and you really should enjoy it and love it.
When it comes down to barriers, people do have to ask themselves, are they their own worst barrier? And I really do want people to give some time to a little soul searching to understand that it may sometimes not be an industry slowdown. Sometimes it may not be that there's no key opening because you don't have experience, or there is a limited managerial opportunity because you don't have any managerial background that you're coming from, and you're looking for that all-important, again, first opportunity. I do want people to realize that they have personal responsibility and accountability to make themselves as marketable as possible, and as professional caregivers, you really do have to constantly look inward to try to understand, is there something about me that's holding me back?
Our organization targeted the minority nurses. We have mentoring programs set up for the minority nurses, and to help them, we partner with hospitals to help them and mentor them into the workforce.
My name is Thielen. I'm an academic advisor at the University of Colorado College of Nursing. We're able to offer students different programs that we have at the university. Students who are looking to further their education, meaning they're going from RN to BSN, or if they're just looking to go to nursing school, or even if they have their BSN, they're looking to get into the master's level as well as their PhD programs.
My name is Mike Nielsen. I work for Banner Health in their talent acquisition office. I'm the region sourcing strategist. I'm attending the event today as a benefit to my company, not only to kind of help branding across the organization, as we sometimes don't have the largest marketing side to our organization, and we have to get out to these events and put our names out there, but the Colorado Hospital Association has always done us a great deed by giving us great candidates to talk to. I feel that we add a little bit of a benefit to the candidate by giving them some techniques when dealing with recruiters, or i.e. maybe looking at ways that they can pursue their jobs a little bit better and make them more efficient in their efforts as well too. And then of course, the association itself, we can't thank enough for everything that you guys do for us. It's always a benefit, and it's been a wonderful continued partnership.
Hello, my name is Daniel Wall. I'm a new graduate RN from Associate Degree Nursing Program. I'm here just to try and meet and network with some people because the market in Denver is pretty competitive. I've been applying since I passed state boards in June, and haven't heard back from many people, so I'm just trying to get creative and try and get my name out there and see what my available options are.
I go home and I know that some decision I made that day or something I did personally impacted a patient. And what else is better than to say you made someone's life a better experience or whatever? And I think by being in healthcare, no matter what you're doing, if you're cleaning the floors in their room, it doesn't matter. You're really helping our patients. And I think that's really one of the blessings that we have.